Thank you, ladies and gentlemen, and welcome to this meeting of the Integration Joint Board of Perth and Kinross of the 21st of August 2024. My name's Councillor Colin Stewart. I'm the chair of the board, and I'm joined by Jackie Pepper, our Chief Officer, Donna Mitchell, our Chief Finance Officer, and Adam Taylor, who's acting as clerk to the board today. Are there any apologies for absence or substitutions?
Yeah, thanks, Maureen. Yeah, just to confirm, Bernie Campbell's the only apology that we've received for the meeting.
Thank you, and I understand Mr. Black from NHS Teesside is just running a little bit late getting to the meeting, so he'll be joining us very shortly. Are there any declarations of interest in items before us on the agenda today? No, thank you very much. Item 3 on the agenda is the minute of the meeting of the IJB of the 5th of June 2024 for approval. Are there any questions on the minutes, or can we agree the minute of the last meeting? Agreed? On a general eye? Great, okay, thank you. Item 4 on the agenda is the action point update. Chief Officer, do you want to run through that?
Thank you very much, Chair. In relation to the action points, I'll pull together action points 142 and 147 and indicate that they're assigned as complete, but we'd want to note that we had a very helpful and useful primary care a development session on Friday of last week. However, I think we do need to focus a bit more on, it was a really useful session, but I focus a bit more on the lessons learned from the previous branch closures and return to that at a future session. I think that was something we could have addressed more fully, so we'll do that in the future. In relation to action point 148, we will hold a development session on the National Care Service before the end of the calendar year. And item 149, a further Tayside-wide development session was due to be held. That's not taken place for all of the integration joint boards and NHS Tayside boards together, but we have had a number of different development sessions in June and August. This IJB had a very full update on the Mental Health and Learning Disabilities Whole System Change Programme at its meeting in June. Unfortunately, the other two IJBs and NHS Tayside board were not able to receive that report due to the pre-election period. But have had development sessions earlier this month on that very topic. So the aim was to ensure that all of the boards were had a shared level of awareness, and there have been further discussions with the chairs of the IJBs about future sessions and synchronising some of our developments and decision making. Thank you.
Thank you, and I think we've got a question from Mrs. Auld first of all, and then I'll come to Serena. Sandra, you're on mute. We nearly heard you there. The sound came on momentarily, Sandra. I'll let you try and unmute yourself, and I'll just go to Serene. Oh no, there you are. Go for it now, Sandra, please.
Thank you very much. So thanks to the Chief Officer for that update. I noted when I was reviewing the papers for today that the development session for the National Care Service hadn't been planned yet, and was a little bit concerned just about the timelines regarding this. My colleague Serene McCartney and I have been part of a group linked to the Health and Social Care Alliance that has actually gained an extension to the consultation period regarding the National Care Service until the 20th of September. So just conscious with these timelines that are moving on, and the bill that will be presented is continuing to be developed. I just wonder if, as an IJB, we should be thinking about bringing forward the development session relating to this. Thank you.
Thanks. Have you got an update on that in your strategic update? So we'll pick that up under the Chief Officer's strategic update, because she was already going to cover something on the National Care Service, if that's okay.
All right, thank you.
Serene, question? Or, it was this. Okay. Okay, thanks, Serene. So it was basically the same question. So there being no other questions I'm seeing on the action point update, we'll then move on to the Chief Officer's strategic update at 7.1 on the agenda. So if you want to... Oh, I beg your pardon. Sorry, I'm skipping way ahead. Item 5 of the agenda, are there any matters arising from either the minute or from the action point update? No. Oh, Mrs. Summers.
It's just an observation, well, not an observation, a comment really. I believe that the Perth and Kinross mental health and wellbeing board meetings have been cancelled until the end of the year. Got that from Chris Lamont. I just wondered why that is, why there's no meetings till the end of the year. Seems a long time, you know, when there's so much going on in mental health.
Which particular group meetings were you talking about? Meetings of which particular group?
Perth and Kinross mental health and wellbeing.
Thanks. So, Maureen, that's something that I wasn't aware of, but we certainly can look into that and come back to you on that. So I'm not aware of the details surrounding it, but we'll come back to you.
Okay, thanks. If there's no other matters arising, then the next point on the agenda is the membership update. Just to advise that we do still have a vacancy on the Integration Joint Board for a non-executive member of NHS Tayside. And my understanding is that that appointment will be made at the next meeting of NHS Tayside Board at the end of the month, the 29th. Okay. If there's nothing else on membership update, then Chief Officer strategic update.
Thank you very much, Chair. I'm conscious that the IGB last met in June, and that we've had a period of summer recess in between, and that the key areas of strategic importance are actually on our agenda. There was a couple of areas I wanted to highlight, and picking up on Sandra Ald's question, was going to draw attention to the fact that the Scottish Government published draft amendments to the National Care Service Bill via ministerial correspondence to the Health, Social Care and Sport Committee, and that was on the 24th of June. And the response of the committee was to call for views with a deadline, as Sandra has indicated, of the 20th of September. So the proposed amendments to be lodged at stage 2 of the bill are set out in the correspondence, and but the Scottish Government's vision for the National Care Service remains unchanged, but there are some changes within that correspondence, that primarily the creation of a National Care Service Board to provide national oversight and improvement of social work services, social care support and community health services, and anything that's within the scope of the National Care Service. And secondly, to bring greater consistency of local planning and delivery through reformed integration authorities rather than care boards. So there are some changes in there. So I'm happy to signpost members to the relevant papers and the call for views on that. And as Sandra said, we've not managed to schedule a development session in advance of the 20th of September, so there's a month to consider that. But interested in the views of board members on whether that would be helpful. Secondly, the other area that I would like to draw your attention to is the establishment, or well, it's the changes in the what's called the Collaborative Response and Assurance Group. Now that's a national group jointly chaired by the Cabinet Secretary for Health, Neil Gray, and the COSLA spokesperson for Health and Social Care, Councillor Paul Kelly. That was originally set up to provide oversight and direction to the health and social care system. And more recently, in response to key areas of concern and particularly surges and escalations in the numbers of delayed discharges. So that meeting has been stepped up to weekly, with all chief officers in Scotland required to be in attendance. And the key focus currently is on delayed discharges, and a national target has been set for all health and social care partnerships to return to an agreed rate, which is 34.6 delays per 100,000 population, and to achieve that by October in advance of the winter period. So that takes us back to pre-pandemic rates, and for Perth and Kinross, we have been on the whole performing very well, but more recently, particularly across the month of July and into August now, have been particularly challenged. So we've been able to achieve that rate roughly about 44% of the time, and the reasons for that are related to staff sickness, summer leave, and COVID in particular has been prevalent in Perth and Kinross. So nationally, Perth and Kinross is assessed as low to moderate risk. So there's not been a focus on us locally, but we remain focused on this area with a huge amount of improvement activity, and particularly in the run-up to the planning of our winter plan, which will be brought before the IJB in October. So we're looking at this weekly and in some cases daily in terms of the activity there, and continue to have local oversight of that. So just really wanted to draw your attention to that and indicate that we'll give you a more detailed update in October at our next meeting, along with our plans for winter. Thank you.
Thanks, Chief Officer. Have we got any questions? Doyle?
Hi, thanks. I'm aware that across NHS Tayside, with all three partnerships that we work with, we had agreed a RAG status for delayed discharges. I know that the Perth and Kinross discharges have recently been in the red part of that. How does the agreed RAG status locally correspond to that 34.6 per 100,000?
Thank you. The national target is actually not as stringent as the local targets that have been set. So the local targets for Tayside and for each of the health and social care partnerships are about capacity and flow for our local systems. So so that there is a disparity there. Yeah.
Thank you. And Mrs. Auld?
Thank you, Chair. My comment is regarding the initial conversation about the National Care Service, so I'm happy to wait until this part of the conversation's finished, if that's helpful.
No, you're okay, just carry on.
Okay. So the chief officer had asked for views on whether it would be helpful or not to have a development session sooner rather than later. So I just wanted to feed back a couple of things that the committee in general may not be as aware of. There obviously has been much ongoing discussion and changes to the National Care Service Bill. There are a number of committees and groups, some of which are made up with people of lived experience, and I'm part of some of those groups, so have been able to, with colleagues, been able to feed into some of the discussions. The reason that I think it is important for us as an IGB to have the discussion is also because there is ongoing unhappiness from some of the groups and organisations around the interpretation that has been chosen to have been taken of their input into the suggested changes, where it's been felt that the changes that have been suggested by groups and organisations are not then reflected in the outputs, and people are feeling less represented than they would like to be, and that has been the focus for at least 2 letters that have gone to both the Minister and to the convener of the Health and Care and Sport Committee. And I'm also part of a governance and representation group, which is looking at the potential membership of the National Care Service Board when and if that comes to pass. So I attended the first meeting of that a few weeks ago, and the second meeting is actually taking place in Edinburgh today as we speak. So obviously I wasn't able to attend because of the clash with this meeting, but we'll keep the group updated on progress with that group. So just to summarise, I do think it would be valuable to be able to have, as an IGB, a discussion around the direction of travel of the bill. Thank you.
Chief Officer.
Thanks very much, Sandra. I'm happy to put something in place, just realising that we've got 4 weeks to achieve that in terms of meeting that deadline, but happy to put something in place and encourage and support members to attend that within that time frame. Thanks.
Mr. Black.
Thanks for that. Yeah, I would welcome having a discussion on that, because I'm unsure. The person was talking about the input not being represented, and I'm unsure whether it's not been represented or it's not been discussed, because it may well have been discussed and then the answer was no. So I would need to find out which part of that. That would be helpful for me. Like.
Okay, I think if we can all, Mrs. Sum.
I understood from what Sandra was saying, but maybe I picked it up wrong, was that it was the way it was recorded that didn't reflect the, what the public partners, the lay people had actually said, in the discussions. I understood it was, a recording problem. It was, but maybe I picked it up wrong.
Okay, I think we'll have to, if the Chief Officer's happy to put something in, then we can have that discussion and we can draw out these points. recognising the shortness of time, it might be an online discussion rather than an in-person thing, but we'll certainly see what we can get into the calendar between now and then as a sort of mini development session just on the National Care Service. If there's no other questions on the Chief Officer's strategic update, we'll move on to item 7.2 on the agenda. This is a report on the inpatient learning disability services. It's a single report which is being considered by all three of the integration joint boards in Tayside and by NHS Tayside on the 29th of this month. And the Dundee discussed the report this morning. There's been obviously a long history of needs of a need to make changes to the physical provision of inpatient mental health and learning disability services going back to at least 2017. But this is specifically about the inpatient learning disability service and not about the general adult psychiatry element of that. I'm pleased to say that we have with us today in attendance Sandra MacLeod, who is the Deputy Chief Executive of NHS Tayside, but also undertakes the role of the Executive Lead for mental health and well-being. Mental health and learning disabilities, I beg your pardon. I think I had a discussion with Sandra last week now, and obviously one of the issues that has plagued the sort of redesign of that inpatient learning mental health and learning disability service has been a series of blockages which are outlined for us in the report, but I think it's really helpful that we're actually now making progress and that we've actually got somebody as senior as the Deputy Chief Executive of NHS Tayside driving forward that programme. We've also got online Elaine Watson from NHS Tayside, who's the Director of Human Resources there, James Cotton from NHS Tayside, he's the Medical Director, and Claire Pearce as the Executive Nurse Director. Sandra, am I going to pass over to you now to introduce the report, and then we'll take questions from members. Okay, Sandra.
Thank you, Chair. Thank you, colleagues, for allowing us to come along today to share the paper with you. I'm assuming colleagues will have had opportunity to read the paper, which really outlines an operational decision that's been taken by the senior executive team of NHS Tayside, which includes all three IGB chief officers as well as part of that leadership team. It sets out the rationale based on a more recent internal and an external report and the need for us to expedite the decision. It also then reflects that decision is in keeping with the strategic direction and intent that has been set previously by Perth and Kinross, also supported again in 2023 by other IGBs as well as NHS Board. So appreciate this is just for awareness, and there is some recommendations in the paper, but happy to take any questions rather than go through the paper. Thank you, Chair.
Ms. Hunter.
Good afternoon, everybody. As you all know, my name is Lindsay Hunter. I am NHS staff representative on this IGB. I actually have a statement from all trade unions and professional organisations, and I would like to read this on their behalf today. So please bear with me. It is not that long, but I will get through it, okay? Whilst we as staff organisations agree that the building environment is not suitable, many previous reports have stated that whilst an option is being worked on, that the environment should be kept up to standard, yet none of this has been done. In every report from pre-2017 to date, all comments on the therapies that are provided for both inpatient and daycare has been second to none. Yet if the move to Murray Royal takes place, this department won't be able to be replicated, which will have a detrimental effect on the patients both daycare and inpatient. Existing and early feedback from all the workforce is greater than 80% will not transfer to Murray Royal. Therefore, the service will not be viable. Staff morale has always been reported via various reports, including MWC, as being very low. However, they are extremely concerned for the upset that this is causing to their patients and relatives and fear the detrimental effect this potential move will have on their patients. Considering the experience that the majority of staff saw in 2018, we cannot understand why no other area has been or will be looked at, given that the majority of patients and relatives live in the Dundee and Angus area. The majority of inpatients in Strathmartin are mostly delayed discharges, and therefore we would ask that the priority is to make sure that we get the right care in the right place, preferably within our communities. We ask that NHS Tayside, we ask that Tayside Health Board and the IGBs learn lessons from the past and listen this time to the patients, relatives, carers, staff and trade unions before doing any more. Moving to Murray Royal is just moving into another site which is not suitable for the group of patients that will be detrimental to their health. We would ask that the board look at all other options which the groups could sign up for. That's dated the 20th of August, so yesterday. Thank you.
Would you like me to respond, Chair? Okay, so if I can just summarise just the key points that you've raised, and then if I could bring in colleagues who are accompanying me, through yourself, Chair. So one of the key areas that I've picked up that you've got is that we didn't consider, no other options have been considered for an environmental move. The other one is the impact of the therapeutic environment, particularly from the day hospital, and the 8% of the workforce, and also patients and families. So I will attempt to I will attempt to cover off the options and give you some background on that, as well as understanding how we're supporting patients, families and staff. I'm going to bring in our Executive Nurse Director, Claire Pearce, to make comment on the therapeutic environment and how we've moved forward with that. And also then I'll bring in Elaine Watson for discussing the workforce. Okay. So I suppose to start with, just to really note that in 2017 there was a comprehensive options appraisal that was undertaken and was presented to each of the IJBs. There was numerous options that were prepared at that time, and I think on reflection my understanding is that no option at that point didn't indicate a closure of Strathmartin site. So at that time there was extensive the IGB in Perth and Kinross asked for extensive consultation to take place. There was thousands of people who participated in that, and there's a really good report. I would refer people back to your 2017 report and then to the 2018 report, which has the details of all the consultation. So there were options considered at that time, and the option that was put forward was for a move from the Strathmartin site. So while I fully understand that this feels that no options have been considered, my understanding is the strategic direction has been well set. In addition to that, within the there's been the independent review and oversight as well as the Strang report, and the information that they've been brought back has been led by the whole system change, mental health and learning disabilities change programme, which then undertakes to move forward on those recommendations. That's led by Jackie and co-jointly by more recently by myself. There's been papers brought last year, 2023, to all IJBs as well as the NHS board, reaffirming the direction of travel that was indicated by the oversight board, which is to redesign learning disability services and also to consider Strathmartin site. So that again reaffirms the direction of travel and strategic opportunities that were taken, and those were taken under consideration when we made the senior executive team made the decision from an operational context. We felt that that was there. In regards to patients and families and staff and trade union colleagues, we are absolutely aware and acknowledge the impact this will have on all stakeholders and understand the impact that this will have for families and we're moving forward. There is a parallel piece of work that is underway through the whole system change programme, which will continue, which is about the redesign of learning disability services. And that's where all stakeholders will be engaged, staff, everybody, to really look at how we do this. This is a separate transitional move to help us move on to the Murray Royal site to provide better accommodation, which I'm sure Claire will pick up. We have also set up a task and finish transition group, of which there are numerous work streams. One is about engaging with carers and with patients and their families, and that will be led by independent advocacy service as well as by the Tayside patient liaison team, and really help to work through with families on there. There is a work stream, not easy for me to say, and in addition to that, there is also, along with other work streams, there is one on clinical, which will work with families to independently look at each of their cases individually and work with clinicians and families to see what the best outcomes for those are, so they will be taken into consideration. I will pass on now to Elaine and to Claire. I think they're both joining us online, if that's helpful, just to close off.
Thank you. It's Claire Pearce here, Board Nurse Director. Can you hear me? Okay. Yes.
Yep, loud and clear, thank you.
Okay, thank you very much. Thanks for inviting us along. I'm here with Dr. Cotton, the Board Medical Director, and Elaine Watson, the HR Director. So I'm going to answer the point regarding the environment. Folks will be aware of the long-standing issues regarding the appropriateness of the environment for this group of patients in Strathmartin. We recently had an external inspection which highlighted areas of concern that had not been escalated. The Learning Disability Leadership Team enacted a rapid response plan to ensure that immediate action is taken to address the concerns raised in relation to the environment and infection control. Myself as the Board Nurse Director and Dr. Cotton as the Board Medical Director's view is that Strathmartin ward environment does not and will not be able to provide a therapeutic environment for this group of patients, and we require to expedite the move to single site for inpatient learning disability service, and we feel that consolidating to a single site would be beneficial for our patients. Thank you, and I'll pass to Elaine for her part regarding the staff.
Yeah, hello everybody, I'm Elaine Watson, the Director of Workforce, and I'll just echo others' thanks for allowing us to come to the meeting today. Just want to acknowledge the statement that Lindsay read on behalf of the unions, and in particular the comments about the staff, and just really emphasise our acknowledgement of the impact on staff when there's a decision to make a change such as this. We do have a number of staff who are going to be impacted who have long service within the area, and we do understand that impact. So just want to emphasise what Sandra said around the workforce work stream and the work that will go ahead into the future to try to ensure that the existing staff are their preferences in terms of how they want to continue their career with NHS Tayside are taken into account. No one will be forced to move to Murray Royal, and we will work with them within the Ones for Scotland workforce policies to ensure that they are their preferences in terms of where they would like to work and how to continue their career are taken into account. There's lots of work to be done in that area, and there's a comprehensive workforce plan that will be worked through in consultation with staff side and the staff to make sure that that is done in concert with the work that's being done in terms of ensuring that we have the right model of care and staffing model in Murray Royal when the move happens. So more to be done and more work to be done in terms of solidifying that approach.
Okay, thank you. Are there any more questions? I'll come back to Lindsay and then we'll go to Serene, if that's okay, Lynn.
There we go, green now. Thank you for all your responses. I will take this back to the trade unions that are within NHS Tayside. I'll speak to the employee director personally in regards to what you've came back with your answers. I will like to comment on the 2018 thing because I was around back then, and I do remember that it wasn't me sitting in this seat, that was Alan Drummond at the time. But I remember that cross unions, we did not agree to the single site, and the staff and patients were not in favour of it. However, the board felt it was the best option. So I just wanted to minute that because I was aware of that one. It's good to hear, Elaine, and I didn't expect anything less. It would be going through the Ones for Scotland policies and everything, and I'd be happy to work ahead and see what we can do, because obviously I'm here representing the whole of the staff, and we'll take this out with, and we'll work together. And it's just, it is a big thing because they are Dundee and Angus patients that we're moving to Perth and Kinross, and I don't believe that that is patient-centred personally, and that's me saying something personal here. Don't believe it's patient-centred, and I don't believe it's the right place at the right time. Okay, and maybe I shouldn't have said that, but I feel that I have to morally, because they're not from Perth and Kinross. Thank you.
Thank you. Serene, you were next.
This has been a very difficult report to read, and what I've got to say about it, I hope it isn't misinterpreted, because this has come to an inevitability because of the failures since 2018. As a consequence of that, and we've heard from the unions today, it's simmered and simmered and simmered away, whilst literally no action has been taken to improve the environment or improve conditions with the staff alongside those who are there because of their learning disabilities. It is also clear, I think, that the report itself actually gives, believe it or not, I think, little information, and it seems to me, at this stage anyway, the report is a measure because of the Mental Welfare Commission's visit and what it found. And this has been known, I said about the rapid response, but this has been known since 2018. It's not new, it's just deterioration. And therefore, we're now in a situation that we need to take emergency action, but no groundwork has been done. And the proposal is still a proposal to maintain people in hospital, which I think in some cases will be an abuse of their human rights. I would like to, from my respect, for somebody to indicate how many have been held, is the best way of putting it, I think, as patients, and no action taken for those who can, no doubt, operate outside of an environment of a hospital with support, whether it's sheltered accommodation, whatever the arrangements should be, and then indicating to us so we have a clear understanding of what I think we should be asked to do here. We need a clear understanding of the types of disabilities that are so complex that they need hospitalisation. And this isn't about identifying individuals. That's not a good enough reason for not informing us what the issues are and what we need to do about those issues. And so, from that perspective, I'll do a note up, if you don't mind, Chair, because others will want to speak in this. But this is a situation which will not only requires immediate treatment, but the capital resource for this. It'd be interesting to know where that's coming from. I know it will say Tayside, but there is significant capital resources here, whether you pick the single site option, something I wouldn't disagree with, or whether or not you need capital resources for those who can and should be in the community in some form of supported housing. And that would be interesting, because I'm assuming if that's not forthcoming, they'll still be in the same situation that in the current places being detained, because we've no policy or no resources to give them what they're entitled to. as an effective living environment and the ability to live the fullest life possible. Thank you.
Thank you very much, Ian, for the points that you've raised. What I would like to do is respond from a Perth and Kinross perspective in relation to the people affected by this. That as a health and social care partnership we have responsibility for. I'm unable to comment on individual circumstances and unable to comment on the numbers associated with that because they are small in number. But we had an update to this board on the 20th of March on the Autism and Learning Disabilities Strategic Delivery Plan. And within that, an update on the advances in relation to our complex care transformation project, which has been underway for a significant time. And that this integration joint board has prioritised investment in this particular field, recognising the level of need, the rising need in the community over time and the level of complexity. So we know that over the last few years, the IGB has invested over £6 million into this area and continues to do so through our multidisciplinary teams. And as a result, we had a report that mentioned the core and cluster developments where we have accommodation and bespoke accommodation available. So from a local perspective, we know that we are able to deliver on plans within the time frame that's set out in the report before you for our Perth and Kinross patients affected by this.
Thank you, Chair, and thank you very much for your comments. I think just to really reflect the work that Jackie describes, and the same work will be going in the other two IGBs as well. You're absolutely correct that the aim and the ambition is for people to be remaining within their communities, and that is the ambition that we have. Unfortunately, at this moment in time, people are not immediately ready for discharge. Even those who are ready for discharge are undergoing delays because there isn't the accommodation or there isn't the ability for the IGBs to recognise and to be to be able to source that. So we're working as a whole system together to really move that forward. The immediacy of the issue, just to give the board some assurance, there has been investment on the Strathmarch site for dealing with immediate issues that have required there. What was evident previously and is evident now is it is an old site, and regardless of the investment that's been made, it still will not meet modern therapeutic environment standards. It's not on the back as well, just to give you some assurance. The Mental Welfare Commission did entirely report back in June, but there was a paper that went on the 29th of April to the executive leadership team, which highlighted then and made a recommendation which was brought forward to start to look again at a single site option, given that we were managing across there. So please be assured this is not just a reactive thing, that there has been due consideration and cognizance taken of this, and we are trying our best to work a whole system and really design what is best for people to be within the community. Oh, sorry.
I listen with incredulity, to be frank with you. Come on. Pardon? Oh, sorry.
Thanks. And I know you want to come back in, Serene, but just to ask, there was one point that Serene raised, which was about the lack of detailed data in the report. I don't want to preempt an answer, but I'm imagining that is because the individual discharge plans for the patients need to be worked up over the next year, and we will get that data coming through in the quarterly reports, because certainly the lack of data was something that I had noted when seeing a draft of the report. But if you want to come in that point, then we'll come back to Serene.
Yeah, absolutely. And as I explained earlier, I just refer colleagues back to the task and finish group will have a number of work streams, and the reports that we will bring back to both the IJB as well as to the NHS board will be an update on those work streams. So there will be a lot more data about what's specifically been undertaken, the work that's been underway and how that's progressing.
Thanks, Serene.
Thanks, Chairman, for your intervention. I said incredulity, and the reason for that is looking at the record of failure over these years. I'm not sure, even passing this, that this will happen in a time scale necessary to deal with the situation in regard to those who are suffering. Their lifestyle and their life opportunity, difficult as they are, can't be enhanced in the environment they're in, and that must make it difficult for the staff as well. We're totally committed, and my eldest granddaughter works in the establishments like this in Aberdeen at present, and so I know exactly how staff are affected by these things, and so it's not an anti-staff point. And are we going to appoint a senior responsible officer? I know we've got chief executives, directors, in a programme this size, you really need to have somebody nailed on as being able to make decisions and drive things forward.
Come back on that. Yeah, it's an absolute point. We do have a senior responsible officer attached. There's a programme board set up, and really taking cognizance of all the views that are here and the views of the staff, patients and families. We've sought and have been able to get external support from that. So we have a learning disability specialist nurse from aligned to the programme board, external from Scottish Government, as well as psychologist, a learning disabilities consultant. We have the Mental Welfare Commission, we've got Health Improvement Scotland, all around the programme board. So we have really rigid oversight of the task and finish group to make sure that the work streams are there, and also really seek independence about how we're moving that, as well as patient representative on the board as well. So yeah, absolutely valid point, and take that. We've certainly taken that forward, and that's established.
Ms Summers.
One of the drawbacks here seems to be the reluctance of staff to transfer to Murray Royal. What are the options given to the staff? Are they told they've got to transfer, or what else?
Elaine Watson, do you want to come in on this?
Yeah, I'm happy to respond to that. So, as I've said, nobody will be required to go to Murray Royal if they don't want to. So there will be a comprehensive approach to working with affected staff to understand their preferences in terms of working elsewhere. Within, and if it's within the Dundee area, then it will be within the Dundee area. We will have a comprehensive approach to identifying opportunities for them that match their preferences, and that will be the work that the workforce work stream will be focused on. In terms of the details of what those options look like, it really depends on the preferences and what's available across the area that they would prefer to work in, and that's the detail that we'll be getting into in that work stream.
Is there anything being done to recruit people ahead of this? Because it's going to be a crisis, really. Ian. Are they looking to recruit extra staff if these staff are unwilling to move?
Would you like me to come in on that again, or?
Yeah, sorry, I was just assuming I would come back in with.
Yeah, no, that's okay. So not at this point. We are working up the staffing model aligned with the care delivery model, and we also, although there's mention and appreciate Lindsay's intel on staff preferences, but we haven't actually gathered that yet. So we don't officially know who is interested in moving to Murray Royal and who isn't. So we'll triangulate that information, the care model the preferred staffing model and the available staff, so that we have an understanding of what that looks like before we then work up a recruitment strategy.
Lindsay Hunter.
Yeah, just on the back of what Elaine said, I'd like to stress that when I said 80%, that is an early indication, which means we've not went through any of the organisational change or asked them preferences. We have went to that area and spoke to staff. That's where that's what's happening. In regards to, oh, ever lose your train of thought? Goodness. Sorry, guys. I will, if it comes back, I will put my hand back up. Thank you, Jackie. Yes, recruitment. It's in regards to, obviously, these nurses that work within Strathmartin, and I'm talking about Strathmartin by itself, they have learning disability training. And I think a concern that we have is that learning disability nurses are they're very far and few between. It's now mental health. So it's just to make sure that if the staff make that preference that they don't want to move, which they have that choice through the organisational change process, that the patients that are, if this move goes ahead, if we're moving them to Murray Royal, that the staff that will be treating them in Murray Royal actually have learning disability training and qualifications, because obviously it is different. So yeah, I just wanted to say that out loud, and after I got my train of thought, I apologise.
Okay, thank you. We've got a question online from Councillor McCall.
Actually here. I can be virtual if you want. I just want to make a comment, first of all, on the point that Lindsay made there just now. I'm a legal guardian of someone with a learning disability who doesn't at the moment, thankfully, need inpatient services, but I totally concur with your viewpoint that there needs to be specialist, whether they're nurses or other medical staff. But I think that's a given. That's my understanding that that's part of it. My point of clarification I really would like from, I'm not sure from Sandra or Jackie, is my understanding and everything I've seen before in this is quite a long process with a view to ensuring that particularly those on delayed discharges may not necessarily transfer to Murray Royal if there is success in achieving an alternative outcome in the community for them. So I think I'd just like to get reassurance that my understanding of that is correct, and that being the case, that those who still need to remain in hospital might be a much reduced number, and that may also have an effect on the staff complement required, notwithstanding the skills level required, because it probably is more acute. So if you can perhaps give us some reassurance on the length of time being taken and consideration being given to the complexity of this particular change. Thank you. Thank you, Chair.
Thank you, Councillor McCall. Just to confirm that is indeed the case, that wherever possible, what can be achieved in this time frame to ensure that the patients concerned are not having to move twice, but can move to a long-term solution planned for them around their specific and unique and individual needs is the approach that will be taken. And also to give some assurance that the whole system change programme and some of the work that we're taking forward under that was very much looking at a collaborative approach, that whole system partnership approach that Sandra referenced, around where we've got very complex and unique circumstances. We may have to work across the health and social care partnerships to devise solutions for some of those individuals together, because we wouldn't necessarily be able to have the specialist resource sitting in one location. So those are all of the things that we'd be looking at. And also, I'm looking at Zoe because she was part of that and very much a driver behind it, around a collaborative approach to commissioning services in this whole area, which may require us to begin to look at how are we joining up some of our funding solutions around this as well. So all of that is happening alongside this very important paper that comes here, which is of necessity and an imperative to move on this at pace. But it was really just to give some reassurance around that other work that's also taking place. It's not instead of, it's alongside.
Mr. Black.
That's what I just want to have clear in my head on this one. It's just the paper I fully understand and I see all the work that's been done to work with and for patients and the best clinical decisions that have been made that this is the best option available at this time. What I'm hearing the resistance here is in the location and staffing. And if that location was going to be in Angus, that same argument would happen. We need to put patients at the very centre of what's happening and sort out what's happening with staffing. The location is that this is the best option. And that's been investigated, checked it, and I think it's the best option. So the other issues, I think we need to concentrate very significantly what is the best for the patients and deal with the other matters as they need to be.
Unless anybody wants to come back specifically on that. Son.
Just to, thank you for your points. Agree. Thank you.
Mrs. Hamilton, Vice Chair.
Thank you. I'd just like to endorse what Martin's just said, succinctly put it into a nutshell as he's good at doing. I'd also like to say that we can't keep looking backwards. I think there are questions and I agree with some of the points that Serene's made. But I think this is about assurance that we are moving the right way for this group of very vulnerable people who we have a responsibility for their care, and to make sure, as you say, they're in the right place and they're looked after in the way that's required. Personally, I'm assured about the work streams, about the direction of travel, about the rigour that will be gone through with both the staff and the families. And this is at a very early stage, and I think we need to make sure the families are not used in any way other than a positive support framework in how we go forward. So I would hope that in the future we can work collaboratively across all the services to take forward the interests of these vulnerable group of people and to support the carers and how we move this forward. So that's my view. I think we should be supporting this. Thank you.
Thank you. Have we got any more comments or questions on this paper? Oh. I'll bring in the Chief Officer and then we'll come to Serene.
I think it was really, thank you very much, Beth, for your comments. It was really just to emphasise the importance of that multidisciplinary planning around individuals and their families, and the importance of including independent support and advocacy for both the patients and the families, because that's going to be key to getting all of the voices heard and the right solutions for the individuals. So that's certainly part of the work that's written into the remit of the group. And I know that we have Danny Shenton, who's online if we required him, from the team who are working with the individuals concerned. And I've got reassurance from that team that we have independent advocacy engaged with all of our Perth and Kinross families and patients concerned.
Serene.
It's just a question, if I can. It's about resources and how they can be allocated going forward, because there's going to be various phases of this. And I'm assuming including people who are placed outside the borough the council coming back in, which would be excellent if the families agree. And there's a potential here for capital sales of 2 hospital sites. And I was wondering if that's the case, whether the money accrued for them at some point can be utilised for these services and development of these services going forward. I think it would be important if that's the case. We had sales of land 2 years ago in Upper Feldy, which had been used, the resources, for direct service improvements, and they weren't sold to a private developer from London. And so I think it'd be quite helpful to get some steer at some point, whether or not those capital resources, if it comes about, could be utilised to improve services and include the staff recruitment and training in that. Thank you.
We would be just talking about one site, because obviously Carsview also contains inpatient general adult psychiatry, and it's on a PFI contract as well. So it would be just the Strathmartin site, but I don't know if anybody wants to pick up the point about finances. Sandra?
Just for assurance, the work stream, there is a finance work stream that's forming part of the programme. So that fundamentally will be looked at, and how future commissioning arrangements need to be looked at, how the resources are allocated. So again, as papers come back and updates come back for boards, that'll be information should be there. Thank you.
Ms. Summers.
I had the same discussion when they were talking about relocating patients from Murray Royal, you know, way back years ago, and they spoke about what would happen if they sold off part of Murray Royal. Would that then go to Perth and Kinross? And I was told any sites that are sold, no matter what area of Tayside it is, goes into the Tayside pot. The money is not used locally, and that's what I was told then. I wouldn't think it's changed at all, but any money that's realised from the sale of NHS properties or council properties, I suppose, goes into a Tayside pot. It's not used locally, and I would think that would still stand. Yeah.
Okay, I think we can. That's probably too fine a detail to provide an answer on just now, but we can maybe come back with an answer on that offline. Ms. Dunk, you wanted to come in.
Thanks very much, and it's really useful to hear everyone's contributions. I would just like to say I support this proposal. I think we've been given a clear rationale. We want to meet the specific needs of individuals. We want to ensure that we're providing a high quality environment for those individuals, whether that's in the community or in a hospital setting. And I think the steps that are being taken are really helpful. It's important that we have a timeline that's realistic, and I think from what I've heard previously, we have timelines in place, and that they will be worked through with the patients, their advocates and staff and the families. So I think it's a very, very important proposal, and one that will, I hope, improve the life chances of the people involved. The one thing I would say is that the third element for me is communication, and I think the communication processes are going to be really important. The communication and the discussions with staff is essential, and to get the right people in the right place to give the service users and the families the support that they need is going to be critical. And I think how we communicate over the next 12 months with families, with individuals, with staff and with advocates is going to be the critical success factor here. So I'm very supportive of the proposal. I've worked with people with complex needs for over 30 years, and I think this is a really a good way to move forward, to give people that independence that they desire, and to give them their place in the community, if possible, in a great environment. So I would support this going forward.
Okay, thank you. And certainly on the communication point, I know that putting this in the public domain was delayed to make sure that there was proper communication with both staff and families, carers of patients up front. Councillor Illingworth, you wanted to come in.
Thank you, convener. It's very clear that keeping this care at Strathmartin and Carsview is not possible in the long term. I do think that Murray Royal will be a fantastic physical place to provide the care. I think everybody should be aware that the big challenge is in every business is always about people, and we talk about how important the care to our customers or our clients is, but we can't deliver that care without people to do it. So the big challenge, I think, with this operation is all about people. So, but I am in support of this project.
And Lindsay Hunter.
Thank you. Obviously, I read the statement out at the beginning, so you clearly can see where the professional organisations and trade unions are at this point. Now, that's not to say that we are not going to try and work together, because our mantra is to work in partnership. But I do think that I need to stress that we have significant concerns that the therapeutic part is not going to be able to be replicated at the Murray Royal site, and that is second to none at Strathmartin. So I understand that will more than likely be through the work streams, because I don't know how it works, but it's just to get I just think I need to say again that I read the statement. I'm not going to go over the points again. I've said what I've said, and for the trade unions and the professional organisations and the staff at an early stage. At this moment, I wouldn't be supporting it from the statement that I've read today. So, thank you.
Okay, thanks. I mean, one thing that I would say, having visited all three sites within the last sort of 18 months, is the actual provision at Murray Royal is a fantastically therapeutic environment, much more so I felt than either of the other two sites, and certainly the potential up at the Murray Royal site would be much greater as well. Councillor Frampton was just asking if you could pass on the statement by email, because she was online and there was sound issues hearing it. If you send it to Adam Taylor, he'll circulate that. Are there any more questions or comments on the paper? No, okay. So can we agree the recommendations? The board is asked to reaffirm the strategic direction agreed in 2018 and 2023, acknowledge the development of a comprehensive programme of work to progress the move to a single site by August of next year, 2025, consider quarterly progress reports to the board, and make sure that communication and engagement with staff and patients and carer cohorts is aligned to those quarterly progress reports. Is that agreed? Agreed. Thank you very much. Okay, that concludes item 7.2 on the agenda. I think we will be spending a bit of time on item 7.3, and I think we want to allow people to change over. So I would propose to take a break just now of 10 minutes until 2:20. Okay, so 2:20, and we'll come back at that point for the joint carer strategy update. Thank you. Okay, thanks very much. We'll just continue on with the agenda. Excuse me. Item 7.3 is the joint carer strategy annual update. We've got a report in front of us, and we've got Zoe Robertson, who's our Head of Integrated Health and Care for Older People, and Alison Gallagher on hand to answer questions. So we think you're going to introduce the report, and we do have a couple of slides for this one as well. So over to you.
Okay, so this is our first 12-month update of the Joint Carers Strategy. As you'll be aware, the Carers Act 2016 sets out national priorities for unpaid carers to enable them to continue caring as long as they are willing and able to do so. That was then enhanced in December 22 with legislation that further supported a national carer strategy, which sets out 12 national outcomes, acknowledging the work of unpaid carers and their criticality to ensuring good outcomes across our communities. So the following presentation, which Alison is going to take us through, provides a progress update on the outcomes identified within our local delivery plan, which target the aforementioned priorities within the National Carer Strategy. Oh, good afternoon. Hi, yes, good afternoon. As I was saying, I'm just going to go through the slides, just gives you a bit of a brief overview of the work that we've been doing and how we're moving towards achieving our outcomes, which have just finished, as Zoe said, the first year of the 3-year strategy. So, oh, right. Oh. We just wait.
Just a small technical issue here in the chamber while we get the slides back up on screen for people online and in the chamber. Just while we're dealing with that, there was a comment in the chat about the sound getting the sound from the chamber getting disrupted. So if everybody can just make sure to speak close to the mic, that may help, although there were also some poor connection issues, so it may be something to do with the network and broadcasting that live over Teams. And we'll just wait to get the presentation back up, the slides. Okay, back to you. Back to you, Alison.
Thank you. So just to introduce the slides there, that's the first one, and move the next slide. Sweaty. So just click through. So the first outcome is that carers can expect clear, reliable, accessible information about local and national support. So we have an information booklet which we revised this year to include a section on carers' rights, and this has been distributed across 3 localities in community groups, health settings, and increasing the awareness of the support that's available for unpaid carers. In year 2 of the strategy, it will be translated into 4 languages to reach across to harder to reach carers. Outcome 2, carers can expect improved provision of flexible and personalised support to support emotional and physical well-being of carers and to enable them to have a life alongside caring. We've continued the rollout of our Carers Act training to social care staff in phase 1, and from April 2024 for phase 2, we've got a new iteration which is appropriate for health colleagues to improve the recognition of carers and communities in line with best practice. We've got greater awareness of carers in communities, including increasing awareness of working carers through Carer Positive, which is a Scottish Government scheme. And we've included some presentations to commission providers. Outcome-free carers can expect that they are listened to and have their opinions valued by professionals. We've improved awareness of support for carers in hospital settings, including work with Healthcare Improvement Scotland on the Triangle of Care and in our Frailty project. Carers Act training also covers ensuring carers are listened to and their views are taken into account as far as possible when planning care for the cared for person across all service groups. Next slide, please. So outcome 4 is that carers can expect opportunities for them to participate as active partners to the planning and shaping of carer services in their local area, including services for the people who are cared for. This is part of the Carers Act, and we do have representation on working groups and strategy group, strategic planning group, particularly from Carers Voice. Nice to see Maureen here, and that influences and informs how we move forward. Outcome 5, carers can expect more opportunities for carer peer support. Peer support is particularly valuable for carers. They might not recognise that, but when it is available, it just makes such a difference to them. So we've improved peer support across Perth and Kinross, recognising different communities and interests, including there's a male peer support group, and there's the Carers Choir, who are called Giat Laldi, and a meeting a Wednesday afternoon in Perth Theatre. They're very good. I've sung along. And that it just demonstrates the benefits. I've also found with peer support groups that they make friendships within that group and they've sustained them through their caring roles out with the group meetings. Outcome 6, carers can expect improved provision of flexible and personalised support to support their emotional and physical well-being and to enable them to have a life alongside caring. This is important. This is about getting breaks from caring, because that will help sustain a carer. We live in a real world, and sometimes it's not all that easy to get support, but we're working through it. We've got a test of change ongoing at the moment to improve respite availability for carers and continuing with as many different ideas as we can to enable carers to have those breaks from caring and allow them to sustain their caring role as long as they're willing and able to do so. Thank you.
Okay, thank you very much. Thanks for the presentation. Are there any questions on the update report before us? Councillor McCall.
Thank you, and thank you for all the hard work that's gone into this. I know how important it is. I'm really just would like a little bit more information, if possible, on the communication strategy, because although there's a link in the report to the strategy, the overall carer strategy, the appendices, that was communications strategy isn't linked, and I'm just wondering how confident you are that you're able to reach all of the carers that are out there. Thank you.
Well, you're right, you've hit on a good point. We don't know where all the adult carers are. And it's unlike the young carers, because between 9 in the morning and 3:30 in the afternoon, we've got a fair idea where they should be. But adult carers are far wider spread. We spent a lot of time and effort through Carers Week this year, and this year, so that was June this year, going into community groups and other health settings to improve the information that's available. We're probably working with the libraries. We've worked with the libraries before just to make sure that wherever people are, that they can see the information that's available, the support that they're entitled to.
I'll happily give you some hints and tips if you want on how you might widen the reach a little bit. I think it, because it's difficult, because very often, both but child carers are often known by their schools, but adult carers are often invisible completely. I totally agree. And unless the person they're caring for is known to social work services or is very actively known to their GPs, they're very hidden. So I think making sure that our reach is as comprehensive as possible is hugely important. And perhaps even thinking about calling on perhaps other council services who, tenancy services and various other things like that might be a way of trying to at least get the messaging out there. So anyway, so I'm happy to have, if you can set something up, I'll help try and give you some signposting to strengthen that. Thank you.
And I think as well worth noting that in terms of identifying people who need support, carers, for example, the council has been rolling out no wrong door training to all staff, so that when you come into contact with whichever service it is in the council, if there's an identified need, that you can be passed on to the right service. Mrs. Summers, you had the next question.
At one time, going back a few years now, GPs used to keep a register of carers, and I believe they got paid for that, for keeping the register. That was withdrawn, so a lot of the GPs withdrew that. That is the best way to identify, unpaid carers, is because they go into their own GP, maybe with problems for themselves or indeed the person that they're caring for, and so the GP can identify right away that that is an unpaid carer and refer them on to, the appropriate services. But that practice is now stopped because they don't get paid for it, I believe. So, I mean, that should be reinstated, so that is the best way to. And the other thing is that all unpaid carers are supposed to get an assessment, Now, if they get an assessment, say what would help them in their caring role, often there isn't the money to help them with what they're saying, would help, because the funding isn't there, there are a certain amount of respite beds and that to give carers a break, to take the care person into, a respite bed to let the unpaid carer have a break. But there isn't enough of that, and, we really need to look more at that, allocating more respite beds so that more carers can get a break.
Thanks. Dr. Peterson, do you want to come in on the point about the register, and then we'll come back to Alison on the point about the assessments?
So just to reassure you, just because we don't get paid for it doesn't mean we don't get coded for it. We still recognise our carers and code them, although it may not be as formal or always get paid for it. But I'd also like to highlight that the carers and PCABs have been really helpful. So over the last year, we've done a few things. We have regular primary care update letters, and PCABs have been really helpful to put in information about how we identify carers and the support that's available. We've also, in the most recent one, they gave us a brilliant update about legal changes that would affect our staff who might be carers, and also, whether you know it or not, you are down for, we have every so often we have drop-in sessions where we invite someone who we think it's really important, and the carers have been volunteered to take part in that session later in November. So although they not be the formal register, it's still very much on our radar, and we've had some brilliant support from them to make sure that we've got all the information that we need as GPs.
Well, that's excellent, and I would expect that from you. But there are practices out there who are not, doing as much as they could do to identify patients and pass them on to the relevant, support that they could get.
Okay, Mrs. Auld, I'll bring you in next, but just Alison, do you want to answer on the point about the assessments and the respite care?
So yes, every carer who wants an adult carer support plan is entitled to have that. Some don't say they don't want them, they decline them. Others you can have an adult care support plan provided either by PCABs or by the partnership. Again, it's not as easy to get respite as we would like, and that's just part of the challenges that we face as a health and social care partnership wider. We are as I said, we've got this test of change running at the moment, and we've got evaluation set up as integral to see that we can feedback and let the management team know how successful it's been, and then we'll see how we can take that forward and how we can develop that.
So just to follow up that point, you said it wasn't easy to find the respite care. So is it a question of availability rather than resource?
It's capacity. So sometimes it's provided by Crossroads or other care providers to when registered care is required, but there's other opportunities to have breaks from caring, like the grant awards from PCABs, Share Care Scotland, Respitality. This is available, but it's finite resource.
Thank you. Mrs. Auld, you're next.
Thank you very much, Chair. I'm not sure what's happened to my screen, but it's now telling me that I can't put things in the chat, so I can't comment or ask questions, hence my raising my hand. So thank you for spotting that. Thank you very much to those that were involved in pulling together this really comprehensive update. It made very, very interesting reading. And as part of that, there was, or there is, access to a national survey that was done of carers, which allows you to look at the results of that in all different levels, from a national, Scotland-wide level, down to health board level, down to group GP practices, down to IGBs, and to individual practices. And I just wonder, so I had a look, it was really interesting, and some areas of really good care and responses from carers, and I guess, as you would expect, a variability of the level of care and the level of satisfaction. And I just wondered if, so for example, one of the practices in Dunkeld came out, scored really highly on all of the categories. But I just wondered if, again, as an IGB, we were looking at that level and drilling down and looking for areas of good practice that could be interpreted elsewhere, and also highlighting areas where improvement was needed. Is that something that we're routinely doing? Thank you.
Not able to answer that question at the moment, Sandra. We'll go away and ask and come back and let you know.
Okay, thank you very much. Thank you.
Okay, if we've got any more questions,
Thank you. I'd also like to commend the report and thank you for all the work that's been put into that. And it was an easy read. It's not too much detail that it doesn't fit in with the narrative, which is always good. But what I wanted to particularly highlight was I was really assured of the fact that the carers work very closely with the rest of the third sector. So I think that's one of the things that came through that report, that you don't work in isolation. We work with the carers and other people work. So I think, Sheila, that's one of the opportunities of that joint working, that to expand knowledge and contacts. The other thing I was going to comment on was particularly the technology enabled care. And I think the work that you're doing with that looks really interesting. I'd like to come along and see it myself, but if that's possible. But it's one of the things that I think can make a huge life-changing difference to people who don't appreciate what technology can do. Just the smallest things can make such a huge difference in responsibilities and being able to give people a sleep at night. So I just wanted to commend that. And if you don't mind, I'd like to come along and have a wee look at that. Oh, it's because of me.
So thank you for that. I will speak to Anthony Clark, who's the tech project manager, and we can organise. We have the smart flat in Canoe Street, part of Carpenter Court. It's got all the gizmos and gadgets that you need. There's also been there's a gentleman that's involved with PCAVs and who's making up videos about the value of Alexa devices for unpaid carers, particularly dealing with somebody with dementia. So if it just means switch on the lights or close the curtains, these devices can do that if you've wired up your house properly.
I think I should know. I'm out of touch with that, but I know that I worked with somebody who did that before, and what a difference it made personally and professionally. So I'd really appreciate coming to see, but we'll get in touch. Thank you.
Thank you, and I think we probably want to open that opportunity up to any of the other members of the board that wanted to come along and attend. Serene, you want to come in? Oh.
Right. The Dunkeld surgery is Craig Dinian, and I'm one of their patients. I think they use me to practice on, but outside of that, we're fine. Very good surgery.
Thank you. Looking around to invite more questions or comments, but I've got one. So I'm looking at the percentage of carers who find information clear, accessible and helpful, and it is a majority agree with that, but for this current year it's much more finely balanced than it's been previously. I was going to ask about that, but then in actual fact it's probably a statistically small number, because the number has dropped off from 218 2 years ago to 14 participating in the survey this year. So I think my real question is, how are we going to, what's the root cause of the drop off, and how are we going to get more statistically significant results when the survey is next completed?
So for the year that we had 218 responses, that was part of our consultation for drawing up the current strategy, and we did a mail shot for that. This most recent year, we've highlighted it in community newsletter and in PCAV's carers newsletter, and that's been the uptake. We've highlighted it twice, we've provided the links. So I think we maybe just have to have another look at it. But one of the issues is, because of our system is a case management system, so it's not got a mailing list. We'd have to do some evaluation of who are current carers before we get in touch, because sometimes when you've been a prior carer, you don't want to answer the questions about being a carer. And we have done this in the past where we've cross-matched against PCAV's mailing list as well, and so we get an absolute current membership, and we can do a mail drop in that, and I think that's probably the way forward. Thank you.
Thank you. No more questions on the report? Any comments anybody would like to make? We've got two recommendations that the board note progress to date on implementing the Joint Carers Strategy 23 to 26 and request an update in 12 months. Can we agree those recommendations? Thank you very much. Thank you very much, Zoe and Alison, for the presentation and the answers to the questions. Thank you. Okay, so the next item on the agenda then is an update, for a verbal update from the strategic planning group. Is this Serene? Over to you.
Sorry, people were relieved that we haven't held a meeting this month because we're waiting for 3 reports that we commissioned about the re-engineering of the work that's getting done, or hopefully will be getting done by the group. We've held a meeting with senior officers and discussed the way forward in this. And it's only due to holidays that the reports haven't been complete, but when they are, we will be calling a meeting.
Thank you. Any questions on for the verbal update from the strategic planning group? We'll then move on to item 8 on the agenda, which is the finance and audit and performance section. First item here is an update from the Chief Finance Officer. Donna, over to you.
Thank you. It feels quite unfortunate that I'm coming after such a positive paper about carers, but you'll note that I don't normally do a finance update to the IGB, and that normally that comes to the Audit and Performance Committee, so this is a different situation. So I have brought this report today to provide the IGB with an update on the financial position. The first full report for this financial year is scheduled to go to the Audit and Performance Committee next month as planned. However, due to the early projections indicating a substantial increase in unplanned expenditure, this report is advising at what we can do at the earliest stage, is advised that the likely actions are going to be required to address this. The financial plan for 24-25 identified a gap of 3.1 million. That's just over 1.2% of our budget. That the IGB approved that 3.1 million could be met through the use of general reserves. However, the early projections are indicating that this may now increase to 8.1 million, which is 3.5% of our relevant budget. So that's a £5 million increase. So that's in excess of the plan. As noted in section 3.2 of the report in front of you today, the key areas contributing to the unplanned overspend include prescribing, include out-of-hours service, care at home, unfunded inpatient beds, care home placements, in particular around older people's services, and for senior medical cover. All attempts will be made to reduce the overspend, and a financial recovery plan is being worked on and will be presented to the IGB at the next meeting. But tackling financial recovery involves several steps to ensure that services remain sustainable and effective in their delivery. The key approaches that we're already taking and are planning to take are noted in section 3.4 of the report. But the process of financial recovery does include us identifying the cause of the overspend. So the finance team are supporting services and managers to analyse data and understand the factors that are contributing to the overspend. We're strengthening the financial controls that we have to monitor the spend, and we're ensuring adherence to budgets with a focus on detecting and addressing issues promptly. We are looking at opportunities to review the allocation of resources, and this may include us reallocating funding from lower priority areas. We plan to engage with the whole system, so that's with other IGBs, with the council, with NHS Tayside, with providers and with staff, to ensure that the challenge is understood, but also to work collaboratively in finding solutions and gaining support for the actions that we may need to take. We are determining if it's possible to accelerate the already approved efficiency savings. And we're also undertaking a further review of our earmarked reserves to help manage the pressures. And this is something that the Scottish Government are also asking Chief Finance Officers to do. And that's to consider and review earmarked reserve balances to identify if there are any areas that can be used differently to support our more immediate pressures. The next steps that will include us progressing all the actions that I've outlined and that are outlined in the report, but you will receive more detail and a full finance report based on the latest position that we have. So the report that comes to Audit and Performance Committee in September will be the most up-to-date that we can possibly get to that meeting. And a financial recovery plan will be presented to the IGB on the 2nd of October. So I appreciate there's not a lot of detail in that report, but you will have that over the coming weeks.
But I would like the IGB to be assured that considerable efforts are already underway and that we are working with partners on solutions and ensuring that they are kept up to date as we progress. So I'm happy to take any questions that anyone may have.
Thank you, Chief Finance Officer. Mr. Black, I think you're first with the question.
Thanks, thanks for the report. And I really am in the belief that everything's been done that can be done. But there needs to come to a time where we're going to have to make decisions what we can and can't provide. And that needs to be that it's been coming down the track for a long time. And there needs to be some cognizance. I mean, that's 5 million in 3 months. And when you look at the delivery of the approved savings, and then when you look at the working with partners to identify opportunities for efficiency and minimise, we're no getting the approved savings already, and then we're going to work to try and get more approved savings. So something has to stop, or somebody has to open their pockets up and stop expecting people to provide miracles and to the detriment of the people who actually need the services. But thanks for doing all the work that you do.
And come back in.
Yes, I would just come back in. Thank you, Martin. One of the reasons that I did put the appendix into the report is for IGB members to be aware of the national position. It's becoming extremely difficult across Scotland for IGBs to balance their books. We are becoming financially unsustainable. Our workforce is becoming unsustainable, and we need to work together to get our solutions to come out of that. We do have a financial strategy for this IGB, and we went through it in some length in order to set our budget, because we need to see our long-term strategy needs to be our priority. We do need to keep that in our sights so that we can work our way out of this. And the financial strategy for us, just as a reminder, is to drive efficiency and monitor performance. That's the first thing that we are aiming to do. And we have identified a number of efficiency savings that are already in our plan, and that is the challenge, Martin, to try and work out how we can accelerate them, the ones that we've already identified. Our second part is that we're challenged to, as part of our financial strategy, to create and encourage transformation of services wherever we can. But then it comes the hard part, and that's the part you're talking about as well, is to prioritise what we're doing and ultimately reduce in areas to fund overall. And that might not be just locally, that might be wider than our IGB decision that needs to happen. But our financial strategy needs to be underpinned by our workforce plan, our strategic plan, which it is, and our reserves, which, as you can tell, are depleted now. If this was to come to reality and we can't get this forecast expenditure down. But collaborative working and the use of technology needs to be a far more focused part of our financial strategy than perhaps what has been before. And I think that needs to be our discussions as we go into the next round of budget setting, is how we work together as cross IGBs, the council and NHST side, and that's a far more present part of our budget for next year, as well as that use of technology right up the front. And I certainly know that we are doing work as a senior leadership team around enhancing our knowledge around technology solutions. So it's something that we're going to try and lead on. But yeah, a significant challenge.
Thanks. And just to follow up on the point about the Accounts Commission report that's there as the appendix to the report, providing a description of the situation facing IGBs across Scotland. Are other IGBs looking to move into financial recovery measures during this financial year?
Yes, it probably wouldn't be fair for me to name them, but there are already IGBs in financial recovery situations for the year 23-24, and they will therefore be there again for 24-25. And there are, like us, others now adding to that for this financial year. And the ones that aren't are probably not going to be long in following us.
Thanks. So I think it was just to sort of emphasise that it wasn't a Perth and Kinross specific position. I've got a few people wanting to come in, but the next one was Dr. Peterson.
You've asked me a question. That was exactly what I was going to ask, but thank you.
Sorry for stealing your thunder. Lindsay Hunter, you were next.
Hi there, thank you for your report. Yeah, you're right, it's a bit of a dire situation. Moving forward, I just know that with the strategic plan and the other plans that had been and the savings that we had identified within the IGB, that does involve workforce people getting moved. Can we out with this meeting, so obviously I don't want you to go in detail right now, but out with this meeting, I'll probably give you a recall and we can discuss that, because I do want to be at the forefront of any workforce issues that possibly could arise. Okay, thank you.
Yeah, that'll definitely be part of our plan. Thank you.
Yeah, absolutely, Lindsay. This is something that can't be done in isolation. It can't be done in a siloed approach either across those areas of responsibility that we have within the Health and Social Care Partnership. The senior leadership team need to be actually working very closely on this and not taking a siloed approach. But similarly, we have a plan to engage with a whole range of people around this in terms of what this actually means and how we can take that forward, because we can't do that behind closed doors. You're absolutely right.
It's in regards to that, I am involved in a lot of your transformation groups, so it's just basically a touch base with you so that I know what we're talking about. Thank you.
Thank you. Yeah, definitely, Lindsay. Martin, sorry, I just wanted to clarify on a point that you made, just for clarification for anybody leaving. The figures mentioned in this report are projections to the year end. So when we set the budget, we talked about 3 million overspend by the year end. We're now talking about a potential up to 8 million if we don't do anything to reduce it. So that excess 5 million is to the end of the year. It's not that we've overspent by 5 million to date. It's just that if we keep going, that's where we think we may be headed. So just to clarify that. Thank you.
Thank you. Vice Chair.
It was just, I don't think it's a secret because the meeting was recorded this morning, but it's just to confirm, I was at Dundee IGB this morning and they were at the paper with exactly the same positions. It's just to reaffirm, that's another word which shouldn't be used. Just to affirm that that's certainly the case across Teesside as well. I don't know about Angus, but I can speak for Dundee.
Councillor Illingworth.
Thank you. If the projected extra overspend of 5.5 million does occur, that would completely wipe out all the reserves and in fact lead us in a situation where we actually run out of cash?
Yes, that's exactly it. If you do get a chance to have a look back through, you'll note on section 3.3, it's just an explanation about what happens if we end up in that situation. So if we cannot reduce our expenditure back into within our reserves level, then we would need to go back to partners with our overspend. But we would need to look at everything before that happens.
Sorry.
Yeah, thanks. And first of all, say thanks for sending not just your report, but the Commission's report. I found that incredibly helpful in revealing about what overall is happening and the importance of, as you say, not working in isolation. There's two things I would like to ask a question about. Is there a better way of explaining saying it's an overspend? Because is it an overspend or an under payment? And if it's an underpayment, we should say so. We're not all throwing money about Perth High Street. So I think we should look at that and why. And second thing is that when we're in discussions later in the year, will you be producing a report which says here's the options for a particular service or whether we make a cut, or if we invest in that one but not in another service, and the reason for it is for example, a better return for the investment in terms of healthcare or patient services, will you be able to go into that kind of detail when it comes to looking at the budget and the options? Thanks.
Thank you, Ian. We can certainly, on your first point around whether it's an overspend or an underpayment, that's something that we can tease out in our finance updates that come to the committee. On your second point, very much so, and I think that is what our budget development or budget discussion meetings that we have on a regular basis leading up to the budget are exactly set up to do, so that we can discuss all the options that we have as an IJB, and we'll do everything we can to bring that with data and information so you're making an evidence-based decision. But that's exactly the arena that we're in, and would make these sessions that we have as part of setting the budget the most beneficial. So yes.
I think on the point about just on Srian's first point about the underpayments, for example, the prescription spending was never accepted as sufficient from the origination of the IJB, so that it will be the case that there are certain budgets where it has never been sufficient for the needs of the Perth and Kinross residents, or where the budget has become less proportional or less sufficient over time because of, for example, the demographic needs of Perth and Kinross residents and the changing expectations. I think Mr. Black is next.
Just another question. See, on the financial recovery that some of the IGBs are in, are there any lessons that we could learn from them? Because at one time, there were quite a few IGBs were less vigilant and dedicated in providing balanced budgets with the full knowledge you'd be able to get. So is there anything that we're going to find from these in financial recovery?
Yes, and I think that's exactly what we need to do. So I've said to you before that I'm a member of the Chief Finance Officer National Network, and because there are so many of us in this situation, and that network is tightening with the sharing of the knowledge. And just this week we've been sharing papers and sharing ideas across the network about areas that we're going to have to explore. So as they develop, I'll bring them to you, and I'll bring these suggestions to you for you to decide as a board if that's something that you want to explore. But I think there's a sense of we're all in this together, and we need to try and work out a way to navigate it. So yes, we will definitely share with others what we are doing and take any learning that they have.
Mrs. Summers.
Point two, and understand all the pressures there that are listed, apart from unfunded inpatient beds. Does that indicate that some are funded and some aren't, and we're picking up the shortfall? Or
Maureen, you may recall last winter, for example, we agreed, or the IJB agreed to temporarily fund additional inpatient beds within PRI for a specific period to help us over the winter. And at that time, that was 7 additional beds within one of the wards in Perth Royal Infirmary, but we currently have 4 unfunded beds within our stroke ward that we manage within Perth Royal Infirmary as well. So we're continuing to support that. So the question, there will be, I think, as Martin said, some difficult decisions to be made around whether we can continue to do that, and what that might mean across the whole system. But those are the kinds of things that we will be having to look at in a lot of detail in terms of. So we will have to look at this and assess what the impact is across the whole system. And present that to the IJB, but we're already working on some things, and there are other areas where, sorry, I'm straying into another question, I think, but there are other areas where we perhaps are disproportionately supporting services across Tayside without that, from a Perth and Kinross perspective. So I think now is the time to have to address that. And I'm looking at David because he continually raises that at the Audit and Performance Committee.
Mrs. Dunk.
So these beds that were, approved, for the winter plan last year, was that not just temporary, or is it ongoing throughout the year? So
Yes, it was temporary to the end of March, but this is in addition to that.
Sorry, I just wanted to make sure you got to finish off your question. Mrs. Dunk.
Thanks very much, and thanks for the introduction to our current position, Donna. I think that's really helpful, and to know over the year the increase, I think, is very significant. So it allows us to try to plan and be maybe at a pace that we've probably not thought we had to in the past. I think the Audit Commission report's really interesting because for me, it's about the real terms movement in the IJB funding. And as someone who's relatively new to this, I find it quite astonishing that the budget decreased by 9% in real terms in 22-23, and taking in addition out the COVID monies. So, we're working in an area where we've got increasing costs with pay awards, etc., which I completely accept staff need to get their pay awards. I'm sitting beside Lindsay. I wouldn't take that away from anybody, but I just wonder how we lobby to try to get people to understand the consequences of that real terms reduction, because a 9% real terms reduction is huge for any organisation. For an organisation providing the kinds of services that we're trying to provide, that's for me, that's enormous. And I just think that, I don't know what the real terms reduction is in 23-24 because the stats aren't in the paper there, but I certainly know that we're obviously continuing to have to make the reductions. And on Martin's point about the lessons learned from those that have overspent, because there are 8 or 9 areas that have overspent, then sometimes it's a bit like Martin said, sometimes somebody comes in on a white charger and gives them money to help their overspend, and we're working really hard to make sure we have a balanced budget or that we don't overspend. So I just think we need to understand what's happening in those other areas and take on board the lessons learned, but also lobby to say, this 9% real terms reduction alongside increases in all other costs, and particularly the costs of staffing, it leaves us with an unachievable goal, really. It's something that it's going to be very difficult to manage in the future without cutting, I think, services that are real priorities. And the government won't want us to cut services that are real priorities, but we're going to get into very difficult conversations when you look at the position over the last 3 years and the trend going down significantly for the real terms funding from partners. I just wanted to make that point.
Okay, thanks. And I have got a question, but maybe if I could reflect on something. Last Friday, was there a hand up? Oh, okay. Last Friday, we had a session on the a development session for the Community Planning Partnership in Perth and Kinross, where Councillor McCall and Beth, Mrs Hamilton and myself attended, who are not normally part of that group. So there is another aspect to continually increasing costs and need, which is to try and take a much more proactive, preventive approach in terms of the public health agenda. I don't know if you want to come in a second. I'm just sort of queuing you up for it, Dr. Fletcher. But to take a more proactive, upfront, preventive approach in terms of reducing the need, so making sure that people can live longer in their own homes without the need for going into care, without being frail, without the need for going in and out of hospital later on in their lives. But it's a very difficult thing to argue for spending, which may have a beneficial effect in 15 or 20 years' time, when you're dealing with a one-year budget situation and you're constantly firefighting in terms of, the financial recovery that we're seeing today. My aspiration as chair of an IJB is that we, as well as managing our current situation, that we do take that long-term approach, because that is a way that you will actually see real terms reduction in need over the medium to longer term. But I don't know if you want to come in, Dr. Fletcher.
Yeah, thank you very much. No, I very much welcome the opportunity with my team and alongside CPP Community Planning Partnership colleagues to deliver a workshop on Friday afternoon concentrating on health and wellbeing. And we really took the opportunity to think upstream. There are a number of public health challenges, as we well know, affecting Perth and Kinross, affecting Tayside and affecting Scotland. And some of the ones that we think of quite immediately, and we have a lot of discussion in the IJBs around substance use, mental health. I was keen that we even thought more upstream about what the population demographics and where we can deliver best impact as a whole system and as a partnership, a community planning partnership with all the agencies around that table. I can't list them all, I'll miss them out, but local authorities, health social care partnership, police, NHS Tayside, third sector, business, a real energy of commitment. We consider child health. If we can get it right for children, we can absolutely make a difference going forward, and that's where our greatest return on investment is. We've got huge challenges around physical activity, obesity, and we have an ageing population, as we've described previously. But all of the public health challenges are intrinsically linked. So if we work with children, we're thinking about substance use, we're thinking about mental health, we're thinking about literacy, we're thinking about poverty. So none of this is in isolation. And I think for me, what was so rewarding about Friday afternoon was being able to have that time with colleagues around the room to think about where can we make that difference together. And we are in incredibly limited resources, but that power of alignment and that power of focus is just so invaluable. So I really look forward to how that work transpires. Spoiler alert, all three are child health, physical activity, ageing are really important public health challenges, but where we as a partnership thought we could deliver greatest impact was through focusing on children and families. So I look forward to that going forward in future. Thank you.
Thank you very much, Dr. Fletcher. I think you want to come in with a very quick comment, Councillor McCall.
Yeah, if I may. I think one of the most interesting things about that was that we had fairly senior representation from across a number of service areas within Perth and Kinross Council, and the services that aren't not often thought about as making a direct contribution, such as housing, economic development, and all of those. So that narrative has started with some more vigour, I think, within Perth and Kinross Council. It's early days, but I think all of these services have a contribution to make to the prevention agenda. It's not, and it shouldn't just be reliant upon the children's services on their own, because they don't have the levers for economic development, they don't have the levers for housing, they don't have the levers for the environment that people live in, etc., etc. So I think that was, for me, that was a very encouraging thing at that session on Friday. So just to give others a bit of a reassurance that we're trying to make sure that everybody who has a contribution to make to addressing the challenges we face are involved.
Thank you, and I appreciate that that's a little bit of a diversion from what we're actually, what's the paper in front of us. But it was my point about having the long-term thinking as well as the dealing with the immediate situation. Dr. Doyle, you're next with a question. Oh, you're forgoing your opportunity. So the next one then was, oh, it's me. Let's that's fine. So, Chief Finance Officer, you outlined the work that was underway in 3.4, such as vacancy control and reducing non-staffing expenditure. In terms of any detailed changes to services in line with financial recovery, do officers have the authority to bring those in before? Is this paper sufficient to give you authority to bring any changes in before the 2nd of October when you come back with the financial recovery plan?
I would say yes, that this paper does. The things that we'll be bringing forward to present to the IGB will be mainly operational decisions that are required to be made, and we will be discussing those with the partners that any discussion would be required. And if anything was going to be cutting across the strategic plan, then that certainly would be part of the presentation to the IGB, and we would be seeking approval for that. But anything else we will get underway with and doing that we would be within the gift of the senior leadership team to do.
Thanks. I just wanted to make sure that gap between meetings doesn't lead to an inability to deal with the situation. Dr. Doyle, you want to come in now, and then we'll come back to us.
It is important now. I thought I could just go past it, but I think it really is important that we are working in partnership. Being here as the medical director's person who's representing him, I think it is really important that we're working in partnership, because NHS Tayside has seen the effects of the beds which went in as part of the winter plan, which have been removed. So you've still got unfunded beds there as part of it, which I believe are in the stroke ward. We don't have them in Tay ward anymore, and we're directly seeing the impact of that. And Perth and Kinross residents will be seeing the impact of that too, because of the number of diverts that are going on when PRI is full as a direct consequence of those number of beds. So I think it's really important that we are working in partnership and that things aren't done unilaterally affecting different parts of the system without working together.
Okay, I think you want to come in on that point.
I could do it without a microphone because my voice is very loud. It's just to echo Monica, Dr. Doyle's point about partnership, which I kind of said before. I would expect that if beds were to be looked at, that it would be across the whole piece and not just an IGB decision, which I would be given. That's a given in my view, but I think it's important that we are all talking to each other, because NHS Tayside are looking at their winter plans right now, and it's just to see where we're at.
Mr. Black.
Just backing up what the header said about the 9% reduction. And if you go to 23, page 23, page 13 of this account commission, you'll see that home care costs have increased by 19%. A 9% reduction increased 19%, and residential 23%. That's nearly a third more. And then when we look at the position that we're in on 3.2, we're talking about care at home, we're talking about beds. I mean, that's a horror manual. It's telling the truth. It's telling the truth. But how we're supposed to recover when it's already telling you about the cost increase in there. Incredible.
Thank you very much. It was really just to make a comment on the discussion, to say that where we are in terms of that level of financial risk is taking us into core services, and that's and is likely to take us into there. I'm not going to go into the detail of that, but I think it's really just the recognition of that from the discussion round the table.
Vice Chair.
Thank you. It was just to highlight that I mentioned earlier there was similar discussions held in Dundee this morning. I think one of the things we're talking about working in partnership from the other side as well. I think Dundee were reporting projected huge overspend in their care at home. and they wanted it highlighted that the whole system aspect of this was positive for acute, because although they were overspent, that was because they were taking more patients out into the community and using their home care. So it's just highlighting that, you know, we do need to work across the whole system because it has its checks and balances. So.
Okay, are there any more questions on the, Mr. Anderson, Dave.
Thanks. Donna, I was just wondering about the care home placements, if we could maybe share the number of placements, the historical trend and what the future trajectory is. Might be useful to take that to a care home forum and share with the local care homes. We can discuss it out with if you want. Thanks.
Yeah, happy to, and we can include that detail in the finance report update that goes to the Audit and Performance Committee, and then the overall cover for the constant financial recovery. But there has, just even recently, there has been an increase in the number of placements, which you may recall we did add. We decided as an IJB to add budget to care home placements for this financial year, but unfortunately it's just not sufficient for the numbers that we're seeing coming through and the increase we're seeing coming through. So we can provide that data, yeah, we will do in the next report. Sorry, could I just add, just on picking up the points around working together, and I was trying to find the key part in the report, so because it obviously describes it better than I will, or it was the key message, number 2, the key message is in the Accounts Commission report, and it talks about how we have got to a situation, and we've probably always been here, or we should have been here, but maybe having money's masked the urgency around this, but we are at the stage where whole system collaborative working is needed as part of the solution, and that we need to work together to get these solutions. So definitely need to be part of the conversations, but I think everybody understanding the pressures that they're under will help us understand that there's not many other places for us to go unless we work collaboratively. So it was just again that as people have pointed out, really hits home this report, and I recognise us so much in the points that are made throughout this report.
Okay, thanks. I'm not seeing any. Oh, I am. Vice Chair.
Sorry, it was just to say, to ask the question, we've talked there about somebody, so the Health Board have started their winter planning process. I'm just wondering, we're talking about working collaboratively. Are there arrangements in place that we're going to collaborate on all our winter plans?
Yes, in short. No, there are a series of meetings diarised already to commence winter planning. In fact, we have a meeting next week to look at that. So, but I think the points you're raising are really key in terms of a truly integrated response to this, because although there are overspends in certain areas, the interconnections between them are so nuanced, it's really difficult to understand it on face value. So those discussions need to move forward for us to be able to come up with something that's going to be effective over this winter period.
Don't think I'm seeing any more questions. I'm just thanks very much for everybody's questions, and thanks for the very full and frank answers. Have we got any comments additionally on the report? Have we picked all those up as we went through? Okay. The recommendations are that the board note the projected financial position for 24-25, note that a full financial report will be presented to the next Audit and Performance Committee meeting. Note the financial challenge facing the IJB is reflected in the Accounts Commission's report on the national position, and agree that the IJB will be presented with a financial recovery plan at its next meeting in October. Is that agreed? Agreed. Thank you very much. I will offer a break just now before we go into the audit and performance and governance items, but it's up to members. Right, okay. I'll tell you what, we'll make it quick. So last time I said 10 minutes and we took 14. So this time, 6 minutes. Okay, so 3:30. We were better that time. Item 8.2 on the agenda is the Audit and Performance Committee annual report for 23-24. I think the chair of the Audit and Performance Committee, Councillor McCall, is going to introduce this or say a few words.
I'll just say a few words. I'll be brief, which I'm sure most will be pleased about. There is a foreword to the report that I'm assuming everybody's read, so I'm not going to read it out verbatim. There's just 1 or 2 points I'd like to draw out. My first point is probably to thank my previous chair who was in post for most of this report, which is Beth Hamilton. So I think the good work that she did and her time as chair made it very easy for me to pick up where she left off and hopefully continue in that good vein. The other thing I'd probably like to comment on is that the work can be quite challenging. You know, we deal with audit and governance and a lot of other issues. And so the efforts of the people who attend the Audit and Performance Committee is greatly appreciated, and the scrutiny that applies. And of course, they're also members of the IGB, and it's an extra part of the workload. So I think that's a really important and valued aspect from everybody. You know, others can attend and observe if they wish to, and certainly if there are papers that people are interested in, I'd be more than happy to see others come along to comment or to contribute to any discussions that we have. But you know, that's the main points that I want to make about the report, and take any questions, I suppose. I should probably also say that this report has already been before the Audit and Performance Committee at its meeting in July. So I think anybody who also sits in the Audit and Performance Committee has probably asked all the questions they wanted to, I hope.
Thank you. Mr. Black.
Not a question, just a really petty, childish thing, mate, that Beth Hamilton and myself are noted as apologies on the 11th of March when we were sitting waiting to get on your technical stuff here didn't work. So we were left in the limbo. So that's my pettiness for this time.
Okay, I'll just have a conclusion then.
Thanks very much. Are there any other questions on the annual report? Beth Hamilton.
I'd just like to thank Sheila. It's the first time I've seen anything linked to my name that says it's conducted both efficiently and effectively, so I'm keeping that. So thank you, Sheila. And my perfect record was spoiled by that meeting and attendance. But I'm not petty.
Okay, anything else to add? Any comments on this? We've got 2 recommendations before us to note the report and agree the level of assurance provided by the chair of the Audit and Performance Committee as outlined in the conclusion of the annual report, and to acknowledge the work and commitment of the Audit and Performance Committee members. Can we agree those 2 recommendations? Great, thank you, and thank you to all of the members for the work that they put in on the Audit and Performance Committee. I know it's an extra. Oh, I beg your pardon. I'm being told, Sandra, sorry, you were big before on the screen when I saw your hand up, but you're a wee in the corner now. So sorry, Mrs. Auld, you wanted to come in and say something.
Maybe all the better for that. Thank you very much. It's just a question, and please do stop me if this isn't the appropriate time to ask this, but it's in relation to the Audit and Performance Committee linked to the Budget Oversight Group. it's a query that I raised before, and the chair had said it would be taken under discussion and would come back to me. So the question was, would it be appropriate for the membership of the budget oversight group to be changed so that public partners could be included in that group, which they're not currently. Thank you.
Hi, Sandra. Yes, we did to have a discussion once the meeting was finished. I think you're referring to the budget review group.
Yes, sorry.
Yes, that is for it's an internal and informal discussion for the voting members of the IJB who may or may not have to make decisions at some point. As I explained before, this does not. It's not a subset of the audit and performance group. It's basically a grouping, and it's a fairly standard exercise that's on certainly within local authorities. For those, I mean, similar in the health board, there are often sessions just for non-executive directors as well. So that's fairly normal that these sorts of things would take place. It does not in any way, shape or form as a decision-making group, and it's more an information sharing and to improve understanding for the voting members. The development sessions that we have as we go forward on the budget and on other matters includes everybody, and there's nothing that wouldn't be shared at those sessions. So I don't see any need to extend or merit in extending the membership. And I think we had that discussion at the last budget review group, and all who attended were in agreement that it should be this small group of voting members only. Thank you.
Okay, Chair, can I come back to that, please?
Sure.
So thank you, Councillor, for that explanation. Can I make it a matter of record that I am both unhappy and uncomfortable with being excluded from such groups by dint of the fact that myself and my colleagues are not voting members. I don't find that to be an acceptable reason for such an exclusion. And I furthermore, I feel that from a governance perspective, those sorts of discussions around, particularly in the current circumstances, I guess, where there are budgetary issues of quite serious significance, I would again ask that that barrier be rediscussed and reconsidered, please.
Okay, thanks. We'll note that comment for the minute, Mrs. Auld. Thank you. Serene, you want to come in on this point?
Yeah, just a short thing. When Councillor indicated it was basically an informal meeting to get advice and understanding in issues, that's true of ourselves who haven't got votes, but we're part of the decision-making process. And I think it is something it's a throwback, if you don't mind saying so, to how people like ourselves have been treated in the past in these bodies, and just here across Scotland. And it's part of the way of enlightening the decision making in the body. It would be very helpful to add this as one of the issues that we've opened up, which previously we weren't allowed to do.
Okay, thanks, Serene. We'll note that comment as well and take that point on board. Just to note that there are the wider budget development sessions that all members of the board, including both the public partners, the stakeholder members and the non-voting members, take part in. And we'll certainly commit to, I think we'll be having more budget development sessions this year than we've had in previous years. But we'll take those comments and make note of them. The next item on the agenda then is the verbal update for the Audit and Performance Committee. Councillor McCall.
Thank you, Chair. This will equally be short. The annual report has provided a good update of the work of the Audit and Performance Committee during 23-24, and my introduction and general comments to that report carries forward to the current year in terms of the work and focus and the commitment of members and officers to ensure we continue to meet our delegated responsibilities and the terms of reference of the committee. Since the last IGB meeting on the 5th of June, there have been 2 meetings of the Audit and Performance Committee, one on the 24th of June 2024 and one on the 29th of July. At the 24th of June meeting, we received a number of annual reports for 2023-24, the internal audit annual report, the annual governance statement and the unaudited annual accounts. In the Chief Auditor's opinion, which again is included in the annual report, she was able to provide reasonable reliance can be placed on the IGB's risk management and governance arrangements and the systems of internal controls, subject to management implementation of the agreed actions detailed in internal audit reports. So obviously our ambition for 24-25 is to maintain or improve on that position. With the annual governance statement and the unaudited annual accounts were agreed, and the audited annual accounts will be considered by the Audit and Performance Committee at its meeting on the 28th of October 2024. The 29th of July meeting was a single subject agenda to review and approve the annual performance report that you've had before you today. Our next meeting is on the 23rd of September, when we will receive an update on the financial position. And just to follow on from the conversations and the comments that were made earlier as part of the joint carer strategy discussion, we will be getting an update on the analog to digital migration programme. So I look forward to that. So that's my verbal update. Any questions from any of you?
No questions on the verbal update. So we'll just note that verbal update then. Move on to item 9 on the agenda, which is governance. First item is 9.1, view of standing orders. This is a report from the clerk to the board, Mr. Hendry. Mr. Hendry.
Thanks, Chair. I'll be brief, as I know it's late in the day and it's been a long meeting. So just to quickly summarise, the standing orders of the board are in place to assist with the overall governance and decision making of the board, and we seek to review them as quickly as we can and on an annual basis. What we've tried to do in terms of this review is to have a look at the language in the standing orders based on previous feedback, which is to perhaps try and simplify the language as much as possible, acknowledging that it isn't the language is very much based on legislation, but it's to hopefully make it a bit more read easy for members and also the public. We've tried to bring them in line with changes in practice over the last couple of years, a move to sort of virtual online meetings and now hybrid meetings. So it just clarifies a couple of arrangements there, and also just tidies up a few recent updates in terms of the legislation. So we've kept the track changes on the standing orders, and hopefully everyone's had a chance to look through it, but happy to take any questions.
Have we got any questions or comments on the revised standing orders 3?
Thanks for this report. Can you enlighten us in relationship to a previous decision that was taken to amend the standing orders, which was called for by the chairman in relation to voting from the non-voting members going forward?
Yeah, so whilst the national legislation stipulates that only the 8 Perth and Kinross councillors and non-exec members from NHS Teesside Board have the ability to vote, what we've done is we've included, based on previous discussions, a paragraph around indicative voting. So if the chairperson decided that we were in a tied vote and felt that it would be helpful to have an indicative vote of the non-voting members as well, we have that. This would propose that we now have that ability in place. I guess what I always try to say when we're talking about the IGB meetings is we seek as much as possible to avoid having any votes, and I know that it's rare that we do have a vote, and whether whether on paper members are voting or non-voting, I hope that they always feel that they have the ability to contribute equally to the discussion. But I guess it's just an option that we would now have if the board agree to update the standing orders.
Thanks. Just in relation to this item, Serene, you'll be aware that at the start of the new council term back in 2022, the leader of the council wrote to the Scottish Government and asked for permission for the public partners, for example, to be voting members. As Mr. Hendry's outlined, that's not part of the legislation, and the Scottish Government indicated that they wouldn't be changing, they wouldn't have time in their legislative schedule to change the legislation. However, we did, on researching the issue, find that indicative voting was part of the Angus IJB standing orders, and so we've included that. I think it's paragraph 15.5 in the proposed new standing orders. So I'm very pleased to see that the non-voting members, the public partners such as yourselves, will actually get an indicative vote if it might help to break any tide situation. Mr. Black, you're next with a question.
Thank you. Just under 3.2, where the position of chair and vice chair is for 2 years, then it will rotate. But my argument has always been that it could rotate to being chair and vice chair, then chair and vice chair forever. Kind of nobody else getting in to being able to do the chair and vice chair. Can that not be after 2 years as a chair, that then you'll not go back to being a vice chair, and after 2 years of vice chair, I just find that kind of bizarre.
So just to clarify, in that point in there is in relation to the integration schemes and the legislation. So the way that it's been set out is that it will rotate between Perth and Kinross Council to choose which one of its 4 voting members would be the chair, and at the same time as that, NHS Teesside Board would also nominate from one of its 4 voting members who would be the vice chair. Then after 2 years, it swaps between the council and NHS Teesside, and it's a matter for the respective boards and council to decide which of the 4 voting members would be the chair. But the main design of the system is so that the chair and the vice chair of the board swaps between the council and NHS Teesside every 2 years.
Okay, thanks. Any more for any more?
I think Sandra, you've got your hand up, I think.
Oh, Sandra, sorry, Mrs. Old.
Thank you. Just to follow on from Serene's question, the intent of some of the content of the National Care Service documentation very strongly suggests that public partners should have voting rights moving forward. And I think that's something that the board has been cognizant of, and I think that our hope was that Perth and Kinross IJB would take, as the chair has tried to do, to take a leading line on this topic. And I think the recent conversation with regarding the budget review group illustrates that the non-voting member position is not just about when issues come to a vote. There are wider ramifications attached to being a non-voting member, and it's to try and remove some of that inequity that exists on an ongoing basis that myself and my colleagues are trying to move towards, and I guess would ask that the board continue to move in that direction. Thank you.
Thanks, Mrs. Auld. Yeah, I noticed that there was a specific recommendation on that point into the Scottish Government in developing the National Care Service legislation. If that's included in the ultimate legislation, we will obviously abide by it and introduce it tout de suite, conscious that the separate local care boards that were proposed will not happen any longer, and it is likely to be the integration authorities which take over that role, and certainly, I think just exactly as you say, it would be great for Perth and Kinross to be leading on that, but I think we've gone as far as we can within the legislation at the moment. Okay, if there are no more questions or comments on this, can we agree the revised standing orders as set out in Appendix 1? Thank you. Next is a report on risk appetite. Can I ask Mr. Jolly to introduce the report?
Thanks, Chair. Thanks, IGB. This report brings a large piece of work together which involved all IGB members over the last year or so, with different exercises being carried out, both individually and via 2 development sessions, which I hope you'll agree were enthusiastically supported by members. So may I please pass on my thanks to you all for that. This work has helped us to get to this point where we're able to present to the IGB our proposed risk appetite statement and to seek approval ahead of further work to refresh our risk management framework. The main changes and improvements that the IGB and the Audit Performance Committee will see following this report's approval is that the Audit Performance Committee will continue to see risk reports at every other meeting, but the risks will have been reviewed in the context of our current environment and will be managed in line with the risk appetite. And secondly, the Integration Joint Board will be asked to consider decisions as we move forward in light of identified risks. This could be, indeed, this could be the risk of making the decision or indeed not making the decision. So I'll happy to pause there with a brief introduction of the paper. Take any questions. Thank you.
Thank you very much, Mr. Jolly. Are there any questions on the risk appetite? Comments? Oh.
Because for whatever reason, myself and somebody else couldn't go to these events, and he took his time out, his own time out to give us the opportunity to make our views known to him. And that was very welcome. Thank you.
Okay, thank you. Thanks. Mr. Black.
I just endorse that. I find the development session really helpful. I thought it was really a good idea and a way forward.
Okay. If there are no more questions or comments, can we approve the risk appetite statement as set out in Appendix 1? Request a refreshed risk management framework be brought forward for approval within this financial year, and request officers to conduct an annual review of the risk appetite statement. Is that agreed? Great, thank you very much. Item 10 on the agenda, we just have some items for information. First of all is the annual performance report for 23-24. Have we got any questions on that? It is for information only. Okay. So we'll note the annual performance report, and then we have the future work plan for both the board and for our development sessions. Are there any questions on those, or can we note those? Okay, so noted. And then we just have to note the future meeting dates and the future IJB development sessions for the remainder of the financial year. Any questions on those, or are they noted as well? Great, thank you very much. That concludes the business on the agenda today. Thank you all very much for your attendance and participation, and thank you to all of the officers who've been in attendance to answer questions and take up the issues as well. Thank you very much all.